Good afternoon. Welcome to our session on tools to evolve your COVID strategy for childcare providers. We are so glad that you're with us today. I'm Dr. Judy Monroe, President and CEO of the CDC Foundation. And first, I want to thank our industry partners who have helped to bring this program to you today. Thank you to all our kin, Childcare Aware of America, the Council for Professional Recognition, and the National Association for Family Childcare for their help and collaboration. As we get started, I would just like to offer a word about the CDC Foundation, since many of you may not be familiar with us. The CDC Foundation is an independent, nonprofit organization created by Congress to extend the health protection work of the U.S. Centers for Disease Control and Prevention. We do so in the United States and globally by establishing public-private partnerships to address a wide variety of health challenges, including everything from chronic to infectious diseases to emergency responses, including the COVID-19 pandemic. Since 1995, the CDC Foundation has launched approximately 1,000 programs. The foundation manages anywhere from 200 to 300 programs each year, and we're in more than 130 countries. The CDC Foundation and Levitt Partners wanted to partner on these seminars because we know that today is a very challenging time for all of us. And the more opportunities we have to work together to share information, the better we are in coming up with solutions to find a comfort level with fully opening our economy again, as well as providing the protection we all need for our employees and the people we serve. Whether you've kept your doors open for children of first responders and healthcare workers, or are just now starting to bring children back, we want you to know that we understand that COVID-19 has significantly altered the way you run your business. We've intentionally built a session that will be informative, actionable, and interactive. Our program today will include a discussion about calibrating our COVID-19 response by Governor Mike Levitt, former Secretary of Health and Human Services. A presentation by CDC on the science behind COVID-19 and the guidance and considerations they have to offer childcare providers. We will hear from Bo Nemelka with Levitt Partners on how to analyze your unique environmental characteristics in a way that will help you feel more confident about making decisions about your unique circumstance. Then we will have an interactive session with childcare specific scenarios to help childcare providers apply the information, guidance, and frameworks to their unique settings. We will then close with Q&A and share where you can find resources to stay informed on getting the latest information and guidance. Our moderator for today's session will be Governor Mike Levitt. Mike Levitt is the founder of Levitt Partners, where he helps clients navigate the future as they transition to new and better models of care. In 1993, Mike was elected governor of Utah, and he served 3 terms from 1993 to 2003. And then in 2003, he joined the cabinet of President George W. Bush, serving in 2 positions. First, as administrator of the Environmental Protection Agency from 2003 to 2005, and then as Secretary of Health and Human Services from 2005 to 2009. At HHS, he administered a $750 billion budget, nearly 25% of the entire federal budget, and had 67,000 employees under his leadership. When Governor Levitt was Secretary of HHS, the emergence of an influenza virus with pandemic potential, known as the H5N1, came about. Governor Levitt had the responsibility for preparing the country for a possible pandemic. He spent 3 years leading a focused effort to enhance our nation's readiness, and he wrote the playbook on how to prepare for a pandemic. Governor Levitt?
Well, thank you, Dr. Monroe, and greetings, everyone. CDC Foundation and the sponsors of our event today are bringing this to us because we're at a very important inflection point in this historic, pandemic moment. Perhaps I could define the moment by using a metaphor. I have a friend, and I suspect you do too, who has had a condition, a healthcare condition that created a lot of pain. Medical providers gave a medical intervention, pain medication. It came with a warning. If you use this intervention too long, or you use too much of it, it will have side effects. As we have gone about working our way through COVID-19 and this pandemic, we have applied a medical intervention. We call it social distancing, and it has been effective, but it has side effects like any medical intervention. And those side effects are economic, they're sociological, even political. That is the way pandemics always are. So as we have applied this medical intervention, it's become clear that we're now reaching a point where we have to rely on other tools. We have to begin to make a very important transition away from large group decisions and activities like closing businesses, staying home, working from home, etc., to more individual kinds of decisions. We're going to be rebalancing, if you will, the way we apply social and individual decisions as we open up. What that means is that all of us are going to be called upon to make individual decisions. By individual, it could be us as a person, it could be a family, it could be a business. Our purpose today is to provide very good information to help us make those individual decisions in a more scientifically rigorous way. So we're going to accomplish in the next 90 minutes these things. We're going to help you learn to adapt the way you do business to begin to mitigate the spread of virus and the impact it has on your business. Second, we're going to review guidance that the Centers for Disease Control have given to all of us. And we'll show you resources that you can use as you do so. Next, we're going to begin to talk about those situations where guidance doesn't provide specific solutions and how we can begin to make individual decisions based on sound guidance and good scientific principles. And finally, we're going to actually practice the way you can apply a very organized way of thinking to specific situations as they arise in your business. Now, I want to acknowledge that we want this to be an interactive conversation. You'll notice on the right-hand side of your screen a chat button. That is your window to ask questions of our panelists, and we would invite you to use it to tee up questions, and as we get to the end, we'll have a lengthy period of time where we can entertain those questions and you can hear from all of the panelists individually. So let's now move to our first presentation. Dr. Georgina Peacock. Dr. Peacock is the co-lead of the Community Intervention and At-Risk Task Force at the Centers for Disease Control. She's a developmental behavior pediatrician, and we'll be calling on her a lot today to not only provide us information about CDC guidance, but to add her medical view as well as a pediatrician, and I might add as a mother. Dr. Peacock, we're really glad you could join us today. We're going to be talking a bit about guidance and the nature of CDC guidance. Would you mind just providing a bit of insight into the word guidance and CDC guidance and how it's used?
Sure, happy to. So we take a few different approaches for getting people information and tools that they need. So we make infographics, we make FAQ documents or frequently asked questions documents. We also make different types of sort of narrative style guidance. And there's a balance between conveying the information we want to convey and then making it understandable. The guidance also runs the spectrum from being really general to providing specific information for state and local health officials to make decisions in their areas. And we also provide some ideas, tools, suggestions to help individual childcare facilities make the best decisions that they can.
Well, thank you. And so what I'm hearing you say is that you're going to provide the best scientific information that's available, but there will be times, in order to keep it understandable and not overwhelming, that it has to be a bit general, and that there are times in which people have to use their own judgment. And a big part of being able to use your own judgment then is understanding what we're up against, particularly this virus. And it's changing. What we know is changing. We're learning more and more as we go. Would you give us the latest things that we know about the virus? Teach us what we ought to know about how this virus works.
Sure, I'm happy to, and I'll be using some slides to do that. But first, I'd like to thank you, Governor Leavitt and Dr. Monroe and all of our partners that are here on the call for hosting this webinar and inviting us to join. I also want to thank all of you, all of the childcare providers that are here on the phone or on the Zoom for taking that time to protect people. I know that are not very easy times and there are no easy answers. I also know how important it is as a parent to feel that your child is safe and that they're safe in childcare, especially now. And the past few months have reminded us all how fundamental schools and childcare are to our country to ensure that children receive an education, meals, social services, and allow parents to support their families. So your response has showcased the creativity, the adaptability that childcare providers show in the classroom or their facility every day. It's a tremendous sacrifice that you have taken over the past few months, and it really has made a difference. And so as we move to reopening, we want to do this thoughtfully. And so I want to sort of acknowledge the complexity of the situation here, and this call hopefully will provide you with some of those tools that you need. So it's my pleasure to talk about a little bit about the science about how the virus spreads. If we can advance to the next slide. So the virus spreads mainly from person to person, and it spreads between people who are in close contact with one another, so about 6 feet apart, through respiratory droplets that are produced when an infected person coughs or sneezes or talks. And these droplets land on the mouths or noses of people who are nearby, or they get possibly inhaled into the lungs. And COVID-19 may spread by people who are not showing symptoms. The virus does not spread easily in other ways. However, COVID-19 is a new disease, and we're still learning a lot about how it spreads. Based on the data from lab studies on COVID-19 and what we know about other respiratory viruses, it may be possible that COVID-19, a person can get COVID-19 by touching a surface or an object that has virus on and then touching their own mouth, nose, or eyes. Though this isn't thought to be the main way that the virus spreads. There has been some confusion about some of the updates on our webpage regarding how virus spreads, and what's important for people to know is that we want to protect people from person-to-person transmission through social distancing, through cloth-based face coverings, and I have mine here that I keep close to me when I've got other people close to me, when social distancing isn't possible. And then potentially transmission from objects through cleaning, hygiene, both remain important. And now we can move to the next slide. There are two strategies to slow the spread of respiratory viruses: pharmaceutical interventions like vaccines or treatments, and then something that we call community mitigation. Community mitigation is a set of actions that persons and communities can take to help slow the spread of respiratory virus infections. Community mitigation is especially important before we have a vaccine or before drugs become widely available. And community-based interventions can be grouped into three categories. So personal protective measures, community measures for social distancing, and then environmental measures. Personal protective measures are things like voluntary home isolation of ill persons, or voluntary home quarantine of exposed household members, covering coughs, using cloth face coverings in community settings, practicing hand hygiene, and remaining 6 feet apart from others. Community measures aimed at increasing social distancing are steps like temporary school or childcare dismissals, social distancing in workplaces like working remotely, postponing or canceling mass gatherings. And then that third measure, environmental measures, are things like routinely cleaning frequently touched objects and surfaces. So as states and communities ease stay-at-home orders, it doesn't mean that the COVID-19 threat is over. Some level of mitigation will be needed in order to continue broad community until broad community immunity is achieved or that we have a vaccine available. The next slide. The decision tool for childcare programs during COVID-19 pandemic is a tool that helps childcare administrators and directors make informed decisions about the most appropriate actions to meet the needs of local communities. Next slide. Additionally, CDC has published CDC activities and initiatives supporting the COVID-19 response and the president's plan for opening America up again. This is a 60-page document that lays out approaches that state and local authorities, businesses, and other institutions can use to plan for the reduction of community mitigation measures while protecting vulnerable populations. And these guidelines propose using 6 what we call gating indicators to assess when to move from one phase to the other. So what we're looking for is decreases in newly identified COVID-19 cases, decreases in emergency department or outpatient visits for COVID-19 like illness, decreases in emergency department or outpatient visits for influenza like illness, decreases in the percentage of positive tests for SARS-CoV-2, which is the virus that causes COVID-19, and the ability in the community to treat all patients without moving to more crisis care procedures. And the establishment of a robust testing program. So within these tools and resources, there's an Appendix F, which includes interim guidance specifically for childcare programs. Next slide. In partnership with the EPA, the cleaning and disinfection guidance helps us stay safe when we return to buildings that may have been empty for a prolonged period of time. And they include steps to protect against COVID-19, as well as other steps that are important for a healthy building environment. And my final slide provides you with some links to CDC materials that actually one more slide, sorry. Yes, this is the right one. So finally, this slide contains links to the CDC materials that I shared today, along with one more link to detailed suggestions for the childcare setting. What I've included on here among these links is is a link to print social media images and videos that can be shared with families and children. There's also a frequently asked questions document about children with special health care needs. And there's a link about talking with children about COVID-19. So I hope these and the other tools that I talked about today will be helpful for you. Thank you.
Oh, thank you, Dr. Peacock. Those were extraordinary, and you will receive as a participant in just a few minutes information about how you can link to those things. They will be enormously valuable to you. But Dr. Peacock, before we finish this segment, can I just say, you're a doctor, you're a public health official, you're also a mother. Talk to us a little bit about your own experience. I think the participants would be very interested to know, what are the concerns that you have for children in a daycare setting?
You know, I think I'm a working mom, and I have 4 children who are now teenagers, but we're all in different types of childcare settings. And I know that in order for me to do the job that I'm trying to do today, I needed to know that my children were safe and in a place where they were being cared for and could stay as healthy as they could. And so I think that's what sort of this conversation means to me. It's giving tools to childcare providers that can help make a safe place for children, for parents that are leaving them in trusted hands with professionals who care for children every day, who need those tools to then help us mitigate or decrease that spread of COVID-19.
Well, thank you. And to all of you, we'll have a chance to ask Dr. Peacock as well as other panelists questions. Note the chat function that's on the right side of your screen. And you can ask this public health official, doctor and mom, questions when we get to the end. So what we have learned thus far, we've learned, first of all, that we're moving in an important way from making large group or social decisions to a decision of making individual decisions. As a business owner, you're going to be making a lot of decisions. And we want to give you the best possible tools. Dr. Peacock has given you the guidance of the FDA, and we'll give you links on how you can find that. We're now going to move to a different discussion. We want to create an organized way of using this guidance you've been given and the knowledge that you'll learn today in how to think about decisions that you will see in your own setting that the guidance won't apply specifically to. So start to think about your own child care setting and ways that you can apply this as we go. So I'm going to introduce Bo Nemelka, who is a public health professional, a colleague of mine, and we're going to talk a bit about 7 different characteristics or situations where the virus is often given an opportunity to go from person to person. So knowing how the virus works and then understanding the situations where the virus often does its bad work, we can begin to interrupt those or eliminate them or mitigate them. We're going to talk about movement. We're going to talk about duration, about proximity, about the size of groups, about respiratory output, touch, and congestion. So Bo, welcome. I'd like you to go through, if you would, each of those 7 characteristics and tell our colleagues today who are participating a little bit about each and how they might affect the spread of the virus.
Great. Thank you, Governor Levitt, and thank you, Dr. Peacock. I, as well, have 4 children. Mine are all under the age of 8, and I truly, my heart and goes to everyone who's on this call who are caring for these little ones. Let's start with movement. Movement is describing the way individuals or children move around in and interact with a space. Directed movement is guided and controlled, with individuals fixed in a specific area without intermingling. Undirected movement is less guided, and individuals freely wander or mingle throughout the space. Because the virus is spread through close contact or touching shared surfaces, spaces where people remain separated and controlled are less risky. So for example, can you implement assigned seats when children are engaged in a seated activity? Number 2, duration. The more time an individual spends in proximity with a positive case of the virus, the more likely they are to be exposed to enough viral shedding to cause infection. Though the exact duration of exposure necessary to cause infection is highly influenced by other factors, generally interactions longer than 15 minutes are considered risky, while shorter interactions like passing someone in the hallway are considered less risky. So for example, are you able to reduce the time in which it takes groups of children to transition between activities in hallways to lower that time, to lower the chances of the groups mixing? Number 3 is proximity. In addition to the length of time individuals spend together, the distance between them contributes to how much of the virus they actually are exposed to. These elements together make up the CDC's definition of close contacts. Based on the average distance the respiratory particles can travel, staying more than 6 feet apart is generally considered safe, while standing closer than 6 feet is considered more risky. So could you indicate spots on the floor, for example, where children could stand when waiting in line for an activity or a meal? Number 4, group size. The intent of reducing group size is to decrease the probability that someone in the group is sick and passes it along to others. As the prevalence of the virus diminishes, it becomes safer for a greater number of people to gather because the likelihood that someone in that group is hosting the virus is lower. Local health authorities will likely recommend a safe group size. Those that adhere to the recommendation are less risky than those who do not. So consider limiting the size of classrooms or keeping the same group of children and staff together every day. And that can happen in both in a facility setting or at home. Number 5, respiratory output. This describes the direction and velocity of an individual's breath. When people are breathing normally, a majority of the droplets do not travel farther than 6 feet. But when they are breathing more heavily from things like exercising, coughing, or with children crying, respiratory droplets can travel much farther. Airflow has an impact on movement of the droplets. So things like fans, ventilation intakes, and outputs, even the wind can spread these droplets in unexpected directions. And they can infect children across longer distance than ambient air. So, for example, maybe we consider whether you can limit the amount of time and activities that result in heavy breathing, or at least limit the group size and the duration of those activities. Number 6 is touch. The virus can be spread by touching objects which respiratory droplets have settled on, or those that have been touched by someone with the virus. Situations in which people share supplies or interact in high-touch surfaces, which we know happens quite often in childcare settings. Those are riskier because of how much touch is happening, but they can be cleaned, and where touching can be avoided, it can be less risky. So for example, how do you limit sharing of toys or supplies between the children? And lastly, congestion. It is important not only to consider the features of the ultimate destination, but how do people or children get there, whether there may be periods of congregation, for example, forming a line or going through a doorway. These points of high congestion introduce risk because of the close proximity and the shared air. Areas of low congestion where people enter in different times or remain spaced apart are less risky. So you might consider how you alter your process for how kids move in and out of activities to limit that congestion.
So, Bo, that was very helpful. 7 situations where the virus has opportunity, and we limit the virus's impact by limiting its opportunities. So let's just apply this. Let's go to a non-child care setting, maybe we would all know about. Let's think about dry cleaning establishment. We've all been in one. If we were to try to use this organized way of thinking to identify the places that this virus has an opportunity to do its work, could you go through an example dealing with say, a dry cleaning?
Sure. So a dry cleaner, when evaluated through this lens, is probably a lower risk situation, but there's a few considerations, and let's look at why. So let's look at movement. Well, you can direct movement in a dry cleaner. Duration, generally people are in a dry cleaning and we're thinking about kind of a front store type setting, less than 15 minutes. Proximity, though, might be a higher risk because you're handing the clothing between the employee and yourself, and there's less than 6 feet there. The group size, you could stay within the limits. Respiratory output is quite normal. Touching, however, could be high because of that passing of the clothes between one another, as well as maybe the transaction itself with a credit card or the like. And congestion, well, that might be lower because not too many people will be there at the same time.
So here's a question. You notice the congestion component is high risk. Is there anything you can do about that?
Yeah, so with proximity and with touch that are higher risk, you can actually begin to put together mitigation strategies and using the tools that Dr. Peacock and the CDC have provided, and this framework, which we are going through, you can begin to think through each one of those higher risk categories. So proximity, you could ask the employee to wear a mask. You could install a plexiglass barrier between them and the customer. You could establish even a separate drop-off area. With touch, right? Prop the door open, clean the door handle frequently, offer customers hand sanitizer, or employ touchless payment options. All of these are strategies that you could deploy to mitigate those higher risk characteristics.
So I gave you an easy one with the dry cleaning to get us started in this organized way of thinking. Let's take a little more complex non-child care setting. Try a gym.
Right. So we're thinking through in a gym. Now, this is more of a kind of your 24-hour fitness type gym, not necessarily a childcare gym or an open area. And we'll talk through that later. But in a gym, it's very high risk as we look at these characteristics. The movement, it's undirected. Hopefully you're in the gym longer than 15 minutes if you're going to get a good workout. Proximity, you could probably stay. That might be a little lower risk because you could stay 6 feet or more apart. Group sizes are generally higher. Respiratory output, right? People are exercising and breathing heavily. Touch, the whole thing is touch. You're touching equipment the whole time. And congestion, well, it can be quite high. So even in a high risk setting like a gym, freestanding gym, you would have several strategies that you could still mitigate that risk. And so we could list those strategies here. We won't go through them one by one, Governor, but you begin to see how this framework could apply to a more risky situation.
Yes, I can. In fact, Bo, it occurs to me that not only is this useful for people in understanding how to deal with individual situations in their business, my guess is there's a few folks on this webinar today who will go to the gym after, and that'll be helpful knowledge to help them manage their own set of risk. So very, very helpful, and thanks for leading us through those. We're going to go in a few minutes now to look at some childcare scenarios where we can apply this knowledge. We're going to move now to a panel discussion. Let's review as we do what we've learned so far. Dr. Peacock taught us how the virus works. She taught us as well that CDC has offered formal guidance that we'll give you access to on how to minimize the impact of the virus. We also have learned that there are certain characteristics of the way the virus works that it seeks out different situations to pass from person to person. And Bo gave us 7 of them. And we've applied an organized way of thinking about those so that we can make individual decisions in our business settings as to how to mitigate them. So now in our panel, we're going to introduce some child care and daycare practitioners. I'd like you all to meet Lauren Kuntz, who is the president and the CEO of the YMCA of Metro Atlanta, and Norma Stinnett, who is the owner of Scholastic Renaissance, and it is a home-based child care center in Bridgeport, Connecticut. And also Jamie Mack, who is the chief of Health Systems Protection in the state of Delaware. And I've also asked Dr. Georgina Peacock, who we met earlier, to join our panel today. I'd like to just get acquainted with the panel and have them tell a little bit about themselves. Let's start with Norma and then Lauren. And would you mind just telling us about the settings in which you work and what you've experienced as you've gone through this pandemic period? Norma?
Good morning. Thank you for having me. My daycare is located in Bridgeport, Connecticut, and when I heard about COVID-19 and how relentless this virus is, I knew I had to go into infection control mode so as to mitigate the spread of the virus. In doing so, I looked at my space and see what I had to do differently. I started with the entrance. I installed another door facing the original door and created a space that I would triage the kids upon arrival. That space consisted of where they would leave their coats, a shoebox for the kids to leave their shoe in, and the area that contains my PPE, my first aid kit, and when the kids enter, I would take their temperature. My infants and toddlers are no longer in attendance. I have school-age kids, so they come with their devices. As we all know, distance learning is happening at home. So when they come with their devices, I take it from them and I sanitize them. The kids enter the daycare. go to the bathroom, and they wash their hands. I also tile the walls of the classroom of my daycare, the infants area, the toddler area. I also took distance outside, social distancing to my playground. I originally had 3 swings and a slide. I installed another 3 swings and another slide so as to maintain social distancing and to create a safe space for my kids.
You've done a lot of work and obviously learned a lot as you have gone. We'll come back to you. I want to know how you have applied some of the things you've learned. Lauren, talk to us a little bit about your job, a little different setting that you're involved in, and tell us about your experience.
Thank you so much, Governor Levitt. I appreciate the opportunity to be a part of the panel today. The YMCA of Metro Atlanta is in a lot of different lines of work and service. And so when Bo was talking about the reopening of gyms, I could do an entire another session on that, as we have had to reopen 18 membership facilities over a 3-week period. So I certainly understand the 7 principles as applied in that setting. But as it relates to childcare, the YMCA of Metro Atlanta, we have 13 early learning centers that serve about 3,000 children in normal times. We have about 4,000 children that we serve in after school and then in day camp in the summer, which is really, again, a safe and affordable and fun way for working parents to have a place for their child to go while they work. We serve about 15,000 children. So it's a large enterprise. It's across the entire Metro Atlanta region. I am speaking on behalf of the amazing counselors and teachers that are working across about 35 different sites in one of these different settings. So when COVID became apparent that COVID was going to be a big part of what was happening in Atlanta, we had to very quickly shut down our YMCA branches, our child care centers, our after school sites. But within about 10 days, we were actually able to stand up what we were calling COVID emergency child care response. And it was open to healthcare workers, to first responders, to those working in grocery stores and in warehouses. And so over the past 2.5 months, while our other childcare facilities remained closed, we utilized spaces at our Ys to serve at this point more than 3,000 children, ages 6 months to 12 years old. And we absolutely had to think differently about how we were going to create safe settings for both our staff, but also for the children and those that were bringing them and picking them up. So it was fundamentally very different in everything that we did as it related to grouping children in age and stage, the intake process from drop-off, the questions we were asking, social distancing. You'd be amazed at how creative you can get to make sure that children social distance. One hint, put a hula hoop around them as they move from activity to activity. As anybody knows that works with children, you have to be creative to get them to follow kind of all of the protocols and guidelines that we have to employ at this time, use of PPE. And of course, I'm happy as we get into the panel to answer specific questions around all of this.
Well, thank you, Lauren. I have to say, I'm a grandfather of, wait for it, 15 grandchildren, and I'm going to try that hula hoop thing. That's a great idea. Okay, Jamie, let's learn a little bit about you. You've got an important job in the state of Delaware, and I know there's someone like you in every state, but tell us a little bit about your experience.
Yeah, so thank you. I serve as the Environmental Health Director for the State Health Department here in Delaware. And Delaware is a bit unique in that we don't have county or local health departments, we simply have a state health department. So that's put us in a position where normally my group is responsible for enforcement and permitting of restaurants and other facilities regulated by public health. But during these times, we've sort of shifted over to be an informational resource for businesses and as well as providing some of the enforcement activities in support of law enforcement and other folks that are helping to enforce some of the social distancing and other requirements that our governor has put in place. And this has been a very interesting time for us because as the sole health department in the state, myself and my staff have been involved in everything from working with the governor and officials to write the high level guidance down to communicating that guidance and helping individual business owners and facilities interpret and implement that guidance. And that's put us in a very unique position, in a very valuable position, because we're able to take the feedback from the individual business owners, the regulated communities, and raise that back up through the channels and ensure that we can correct unintended consequences. We're not being particularly burdensome to a certain industry or group of facilities. And we've been able to establish and maintain a lot of good positive relationships with the community through this.
Jamie, I think that a lot of the participants on our seminar today will relate to some part of your experience. I understand that your wife is a licensed at-home provider. I assume that you've learned a lot about that part of the business from that experience.
Absolutely, absolutely. My wife has had a licensed home daycare for almost 10 years now. And, I applaud her and everyone else in this business, this industry. I certainly, could not do what they do day in and day out. And certainly her, her experience and, knowing some of the parents and being able to talk to them through some of the guidance that we've been developed has been very valuable and eye-opening at times.
Well, thank you. Okay, let's go to some scenarios now. We're going to ask you to think about your own daycare setting. As we go through this, think about the ones we're talking about, but also think of others that will be unique to you and how you can apply this organized way of thinking through those 7 opportunities that the virus looks for in order to transfer from one person to another. So let's talk about, Lauren, you talked about drop off and pick up. And that's obviously something that's quite common to all of those who are here today. Would you mind talking a little bit about your experience? And could I just give Dr. Peacock a little warning? I'd love to hear her experience both as a physician and as a mother and as a health official on what she has learned about this process. Lauren?
Absolutely. So, of course, it really all starts at the drop off, because so much of this is about making sure that your families feel safe. Of course, you're going to be putting the right protocols and following your state safety guidelines as it relates to social distancing and use of PPE, all of the things that are outlined. But there is a big perception in terms of making sure that your families feel safe. And so I think that really starts with the minute that they pull up. So we started kind of journey mapping and really thinking about what would that experience be like as a parent. And we actually did it. We went through our own driveways and kind of worked through it ourselves. So basically, as a family pulls up, we have staff stationed outside of any of our locations. This was during the COVID, the childcare program. We're still running for the COVID healthcare workers. The staff are wearing gloves. They are wearing a mask. And they are wearing a lab coat or a smock of some sort. They go up to the car. They go through a series of questions with the person who is dropping the child off as it relates to what's happening in the home, if they've been exposed to anyone, if they've shown any symptoms. We then take the temperature through no contact. We use one of the kind of point and click temperature scanners, and we take it of both the person who's dropping the child off and the child. And if they are able to answer no to all of the questions, we are able to bring them in. And if they do not have a temperature below 100.4, they can come in for the day. The staff person is the one that takes the child into the center. The parent or caregiver stays in the car. Once the child is in the center, we make sure that they have their own space that's just for them to place all of their things for the day. So it's limiting touch with others. And then they are taken into whatever room for activities. And that is limited based on the square footage. There's a certain number of children and staff in terms of ratios in the room. And of course, social distancing applies as all activities are taking place. So we've thought about that movement, obviously, just making sure that we're directing one, or if it's a family, more than one child together in at one time, not in a group. That also speaks to the congestion. The duration should not take longer than 15 minutes as part of the drop off. Again, proximity, we're limiting who can come in. If there's multiple cars that are lined up, we bring them in kind of each group at a time. And then group size, again, it's either one child or a family that's coming in. And then in terms of touch, again, use of PPE. The children in our care do not have to wear masks if their parents or caregivers would like them to. We ask that the caregiver or parents send the mask with them. But our staff are wearing masks throughout the day and wearing gloves throughout the day and enforcing social distancing. But again, we have to make it fun because we're talking about kids. So I would encourage you and your staff teams to just be very creative about how you make social distancing and games and learning fun in this setting.
Well, it's fun to hear about, and I'd love to just hear a little bit from Dr. Peacock. You've been through this drop off and pick up a few times in your time as a mother. Give us any advice you have as a physician or a mother or as a public health official.
Sure, and I'd actually like to first start off by saying, Lauren, the YMCAs are doing an amazing job in Atlanta. In fact, my sister is a healthcare provider, and my nephew has been going to the Childcare, and it's been a lifesaver, so she can go and provide the care that she needs to provide for patients with COVID. So thank you very much.
I just thank you. That means the world to us to hear that from a healthcare perspective. Thank you.
Yeah, I mean, we've been incredibly impressed. So one thing I was thinking as I was listening to you is that in some childcare settings, the childcare setting is going to ask that parents take their child's temperature either before coming to the facility or upon arrival to the facility. And so if that is the scenario that exists within a childcare, then it's important that when there's a screening happening, that the childcare providers stand about 6 feet away from that parent and guardian and child to ask to confirm that the child doesn't have a fever, they don't have shortness of breath or cough, and then do kind of a visual inspection for a child for signs of illness. And I think that's something that, childcare providers really can tell often when children are not feeling very well. And so looking for things like flushed cheeks, rapid breathing or difficulty breathing, fatigue, or a lot of fussiness. And if you're doing that screen and you're more than 6 feet away, you don't have to wear personal protective equipment. And the other thing that I heard is that the recommendation that if people would like their child to wear a mask, that is definitely something that they can do, or a cloth face covering. And just it's important to keep in mind that we don't recommend that for children under 2, just because of worries about that maybe not being safe. But certainly for children that are older who are able to keep that mask on, a lot of practice, which childcare providers and teachers of early childhood understand about how to not touch your face a lot while you have that mask on. But certainly we know cloth face coverings can provide that extra, another level of protection. So thanks for those ideas. They're great.
Thank you, Dr. Peacock. Let's go to another scenario, and let's take them through the same process of looking at movement, looking at duration, looking at proximity, trying to analyze how can we create lower risk. Let's talk about another quite frequent event that happens in a daycare center, and that would be having to console an infant or a toddler in a home or a facility-based setting. Jamie, you have experience in both of these. You want to talk a bit about how you can apply these 7 mitigating characteristics?
Sure. So if we look at our 7 characteristics for the scenario where, we're holding a child, trying to console them, calm them down, it's a child and adult at that point. So group size is not one of our risk factors. And congestion, because it's just the 2 of us, we're likely, in an area by ourselves, or able to distance, then congestion's not too much of an issue either. But we're looking at things like touch. Obviously, the touch is going to be very important to consoling a child. Movement, it's going to be a little bit undirected, but again, we probably have a little bit of control over distancing, things like that. And then duration and proximity. And for this scenario, I think duration is probably the key because that's the one really that's outside of our control. We don't know how long this is going to last. And proximity, obviously, we're going to be in contact with the child, so that's something that we need to take into account as well. So when we're looking at this situation, there's a couple of simple things that we can keep in mind, and that, as Lauren said, the younger children especially are not likely to be wearing masks. So it's very important for the provider at that point to have a face covering on so that they can use that as a barrier both to protect the child as well as to protect themselves. Because, you know, when we talk about respiratory output, I know that my kids never had a problem with that when it came to being upset. That's something that's going to, you know, increase the risk for the provider. So we want to make sure that we have some type of barrier there. Now, another consideration is a blanket, a towel, a burp cloth, something specific to the child that the provider can place on their shoulder, their chest, that can be the place where the child can rest their head or, you know, touch. Because obviously, if we're going from child to child, we want some way to kind of clean or sanitize between, but it's hard to launder clothes, you know, change clothes, things that quickly. So if we have a specific cloth, a specific blanket to the children, then that's something that can be changed to provide another layer of caution as well. And then the final thing is, you know, the hand washing and hand sanitizing. Really, that's one of the best barriers, best tools that we have to protect ourselves and others. So between children, you know, anytime it's convenient, we want to wash our hands, sanitize, make sure we take those steps.
Well, thank you. Jamie, I think you have applied some very good guidance, principles of guidance. Dr. Peacock, anything to add medically on from the CDC on that point?
Yeah, I think some of the ideas that Jamie gave about sort of putting a barrier between the secretions that happen when a child is crying are really great. Some other ideas are wearing maybe an over large button down long sleeve shirt, making sure that your hair is up off the collar if you have longer hair, like in a ponytail or something like that. I echo that importance of washing hands. You can't wash your hands enough, as well as any other place on your body that might have gotten touched by those secretions. I know if you're holding a baby up close, they may, you know, have some tears that are on your neck. And changing that shirt. So if you do, that's the reason for wearing that long button down shirt or apron or whatever you're wearing, so that you can take it off and put it somewhere else. And those clothes should then be placed in a plastic bag or in a washing machine, so sort of out of the way. And then that reminds me also, it's, you know, and I think this is common practice in childcare centers, but having multiple changes of clothes on hand for the child as well, or the toddler that's in the setting. But I know that that's pretty common. And I guess the last thing that I would think about is, you know, if there's a child or a baby, a toddler, an infant who is crying a lot or seems inconsolable, redo that health screen, you know, not, you know, that visual inspection, you know, is there a reason why that child is inconsolable? And that might be a signal that they are getting sick. And so keep that in mind. And maybe it's worth taking their temperature or calling their parent or something like that, just to make sure that if children are ill, that they they are placed in a place away from other children, so that that we can minimize that spread. So thank you.
Norma, I want to ask you about a scenario around mealtime, but before we do that, do you have any thought? You're in a home-based setting, and talk a little bit about this whole idea of how of consoling an infant or a toddler. You're a very experienced person on this. What advice do you have to add?
I'll take the infants up, hold the infant, and as he says, the length of time you hold the infant, you cannot determine that, because you're going to hold the infant until the infant stops crying, because that's the aim, to console the infant. So I would normally put a burp cloth on my shoulder, have the infant there, and try to comfort the infant the best way I can to, you know, get the infant to be quiet or somewhat stop crying, or to see what the issue is. But basically, I'm in total agreement with what he has said, and he has covered all the steps that I would have taken and have been taken in my daycare to console a crying infant. And as he says, the duration is the hardest part because you don't know when the infant is going to stop crying.
Yeah, well, I'm going to ask you now another hard one. Let's talk about mealtime. How have you dealt with that? And could you kind of walk us through these 7 descriptor characteristics or moments when the virus can do its work and analyze how to deal with mealtime?
Yeah, you're correct. Okay, prior to COVID, the kids, all 6 kids would sit at a table and eat. And before having the meals, would form a line and all 6 kids would walk to the bathroom. We stand outside, wait their turn to go in, hands are washed, they come back, they have a seat. I prepare the meals are served. Or then we may have some days when we have make your own sandwich day or make your own fruit bowl day. So everybody is in close proximity. Kids would also have little assignments, for lack of better term. One will be putting down the trays, another one will be putting down the plates, another one will be putting down the utensils. Again, we have in congestion, we have in close proximity. With COVID, I have done restructuring. So what I've done, I've converted my nap area to a classroom, as my infants and toddlers are no longer in attendance. I only have my school-age kids. So the nap area, I also have a substitute. So my substitute has specific kids that is with the substitute in that area. And I have another set of kids in the classroom. So I'm reducing congestion, I'm reducing size, I'm reducing movement. For the mealtime, the substitute takes the kids that they're as assigned in that area to the restroom, the bathroom, their hands are washed, they come back to their area. The food is served. I take the ones from my area to the bathroom, hands are washed, come back to the table, they get their meals. The other part of it is I no longer prepare meals for the last 3 weeks because I have a restaurant that donates the food already prepackaged and they come labeled, so they're given to the kids individually. These foods meet the guidelines of the Food and Nutrition Program. At the end of the day, when the kids finish eating, I take my set of trays to the kitchen, and with a solution of bleach water, I sanitize the trays, put them away. My substitute does the same with the kids that is in the other area. At the end of the day, the trays are put in the dishwasher for further washing. So in so doing, we are minimizing the amount of congestion. We minimize the group size because we have a small amount of kids now. The proximity of the kids because a few amount of kids are at the table. And we are reducing congestion because the movement is a small amount of kids that we have to move from one area to the next. So in so doing, I think we are able to mitigate the spread of the virus.
That is really a tutorial on how to do it in a home-based setting in particular. And I wonder, Lauren, would you mind thinking out loud about that as well? I thought that Norman did a great job. Talk about it from a larger institutional standpoint.
Well, absolutely. During this time of the crisis, childcare that we've done for the healthcare workers, in that setting, we have actually asked parents to provide meals in a clear Ziploc bag so that each child has their meal for the day. Now, because we've been able to navigate the COVID and being able to have these centers open for COVID, we feel really excited that we're able to actually open up our early Head Start centers as well as a Rise Up pre-K program for 4 weeks this summer. And this was something that you mentioned, Governor, earlier. It's so important. Kids really have lost some time in the classroom, and we want to make sure that kids are prepared as they head into the next year. And so because we've been able to navigate this so successfully, we feel really confident that we can do the same thing in our Head Start Center starting in mid-June. In that setting, we're actually going to be using commercial kitchens that we have on site. We'll be making the food there. Of course, our food service workers will be using PPE, and all of the food will be served in the classroom at tables where children are socially distanced. Of course, all children are going to be washing their hands frequently throughout the day and lots of use of hand sanitizer. But we're going to be serving it in the classroom as we start the Head Start program this summer.
Could I ask Dr. Peacock, anything you'd like to just add as a final word?
I mean, I think you've heard sort of, there are different considerations, whether you're in a small group or a more institutional setting. And so that's where this creativity comes in. We've provided sort of that general framework, that general guidance, but then it takes the creativity of the childcare providers, the owners, and different groups to think this through about how it's going to work in that specific setting. And so I love the ideas that have been provided. They're great.
That does provide actually a very good way for us to summarize where we are up to this point. We talked about early that this is a inflection point in this whole pandemic moment. We're moving from large group behaviors as society to having to make individual discussions or decisions rather. We talked about how the virus works. We talked about 7 opportunities the virus sees to migrate between one person and another, things we want to minimize. And we've been going through scenarios, applying this organized way of thinking on how we can, in fact, find ways to interrupt that. And the individualized component was shown over and over here that it's different in a home-based than it might be an institutional, but we still apply the same areas and see how it affects us there. Very good discussion. I'd like now to just shift gears a little bit and talk about public health. Jamie, you are a public health leader. Obviously, Dr. Peacock is as well. You're someone people can turn to. But Jamie, could you talk a little bit about the way you see child care providers calling on you and your colleagues for help, and ways that you think they could call more if they would? And Dr. Peacock, your thoughts about that would be useful too.
So yeah, we've been working with child care providers, since before this started. We're a resource for them day to day for things like food safety and cleaning and environmental health issues like that. And once we started having positives in Delaware, and specifically then once we had some positives in daycares and child cares, we started getting the specific calls. What do we do to protect the other kids when there's a positive? How do we clean in response to that? What are the actions that we need to take? And we've been able to develop guidance that we've provided out to the child cares. And that's kind of, led into some of the other discussions we've had, other businesses that we've been able to assist. And really, we've just been working to serve as a resource for the community in Delaware throughout this event. And we continue to do that. We've established phone numbers, we've established email addresses that are specific to certain aspects of, facilities and industries that people can use to reach out. And in terms of other areas, if anyone has questions, I would certainly encourage them to reach out to their local county or state health departments. I know that we've been a part of a lot of conversations, both with states in our region as well as nationally, with the other environmental health directors and other health department personnel. Everybody is here to help, and we're really just looking to get those questions so that we can provide the information and be as valuable a resource as we can to the community.
Thank you. Dr. Peacock, you work with public health leaders all over America. So give our colleagues and participants a little advice. If you need help, how do you reach these people?
Yeah, so I think, like Jamie was saying, there is something about what's going on locally. So use those local resources, but also reach out not only to, the CDC, and we've got lots of information on our website that hopefully can help, but also to the child care organizations that you work for. They are working in conjunction with us. We're working with the Administration on Children and Families, who work with Head Starts. There's a lot of people trying to think about ways to support you all. in as you do this really important work for America. I mean, you taking care of our young children is so important, so that people can get back to work and people can do the things that they do to get society moving again. And so it's your creativity mixed with the frameworks that we've provided and the advice of public health officials like Jamie in local and state areas that I think us doing it all together is what's going to make this work.
Well, thank you. Let's talk for just before we go to the next part. I just want to remind you, we're getting closer to the time when we're going to start taking your questions. So look at the right-hand part of the screen. You'll see the chat. If you have a question for any of our panelists, please, or if you have one you'd like to hear everyone comment on, just put it into the chat section. And in just a few minutes, we're going to go there. So let's just quickly review again. We've learned how the virus works. We've learned that CDC provides guidance. And we're going to learn how to access that guidance. We've learned that there are situations, individual decisions that you have to make, and you need an organized way of thinking about it. And we've provided you with a knowledge of how the virus works, but we've also shown you when does that virus start seeing an opportunity. We've talked about those 7 different components: measuring the movement, the duration, the respiratory output, all of those things. So learn to use that and think about your own setting as you do so. Well, speaking of the tools, I'm going to invite Dr. Monroe back from the CDC Foundation for 2 purposes. One would be to tell us where we can find these tools, because we've talked about a lot of things today. I want to remind all of you that if you want to watch this again, it will be posted after it's been concluded. It'll be posted, and you can watch this again and share it with other people. But Dr. Monroe, thank you again for CDC Foundation sponsoring this, along with our sponsoring organizations that you noted earlier. Could you come back and tell us a little bit now about the tools, where they can find them? And perhaps you could go ahead then and lead our question and answer period so that our many participants can ask their questions and hear good answers.
Thank you, Governor Levitt, and thank you for that great discussion, for your facilitation, and for all the panelists. I hope everyone joining today found that to be very helpful, and that it gave you some ideas that you can implement in your own situation. We recognize this is not a one-size-fits-all approach that will work for all situations. Each of you have unique settings, which means that will require a unique plan to mitigate the risks of COVID-19. And that's why we think this framework is so helpful, by giving you a structured approach to think through the risk profile of your unique situation. You can feel more confident about making decisions on how to mitigate the risks for your staff and your customers. We would like to provide you with a tool that will help you work through the process that you've learned here today to analyze the risks in your unique settings. This tool is intended to help you apply what you know about how the COVID-19 virus spreads and the best public health guidance available to make the decisions about your setting and the circumstances that you're working with. The tool is being provided in the form of a blank worksheet that describes 5 steps that you can take to create a COVID-19 risk mitigation strategy for a variety of settings or activities specific to your business. You can download this tool on our website, and you will receive information about how to access this in an email after the event. It's free to use, so please share it with your colleagues and associates who you think may find this to be useful. So with that, what we'd like to do is move into the Q&A session and go to your questions. And with that, if you have a question, please add your question to the chat bar on the right of your screen. And please note, you will need a YouTube account to use the chat feature. Bo will be helping us go through the questions, and we'll be teeing those up for us. But to kick us off, I'm going to start with my own question. The question is, how should the childcare industry be thinking about keeping at-risk individuals, either in their homes or in the childcare setting, safe during this time? And maybe Dr. Peacock, you could kick us off with the answer, and then if other panelists have any comments.
Sure. So I think when I think about that question about at risk, there's maybe two sets of vulnerable populations to think about. The first is the children. So if a child has a special health care need or is at risk, then I think first and foremost, it's having a conversation with that parent about what those underlying health conditions or disabilities may be, and then think together as a team about how best to take care of that child. And in some cases, it may be to delay that child coming to childcare for a while if there's a lot of spread in the community. But in other cases, there may be another way to make sure that that child remains safe, such by limiting risk of exposure or things like that. I think the other group of maybe vulnerable populations are those that maybe staff that are older or staff that have underlying health conditions. And I think they can talk both with their employer and also their healthcare provider to assess that risk. And in some cases, it might be important to give options to staff with higher risk for severe illness to have a position or a job within the childcare that limits exposure, and so modifying some of those job responsibilities.
Yeah, those are excellent points. Anyone else? Jamie, did you want to add anything to that?
No, I think we've covered everything pretty well there. I think in Delaware, we're following, predominantly the CDC recommendations in terms of vulnerable populations, and still working to encourage them to take, some extra precautions.
Very good. So Bo, do you have some questions for us from the audience?
Yeah, we do. We have a lot of questions. So we're grouping them so that we can try to answer as many as we possibly can. So the first one, which most people are commenting on actually, is this idea that parents might be using Tylenol or some other mechanism to reduce fever, and that as a way to mask some sort of symptom. And then others have talked about, should parents be signing a waiver as they enter in? So just maybe some comment. I think everyone here should comment on this because there's a lot of questions about it. So Judy, that's the question.
Okay, thank you so much. So open to the panel. Who wants to jump in on that one?
I can jump in. Well, first of all, that's something we are concerned about as well. So one thing that we do is we take the temperature of the child, of course, as we talked about at drop off. We also take it again after lunch. We want to see if there's any changes in temperature throughout the day that might indicate that there was some dosage in the morning that is worn off. And so I think that's really, really important to think about that throughout the day. The other piece of that, I think, is just making sure that we're continuing to educate our childcare professionals. And as one of the other panelists said earlier, our professionals are very aware to look for particular signs for children. And so just being very aware throughout the day and kind of keeping that extra alertness to look for anything that may be off. We personally feel it's important to sign a waiver. We are doing every single thing that we can in all of our facilities to create a safe environment, but there is risk in anything that you do. And so we really put the waiver out there more from a perspective just that we're being very transparent and sharing with families, exactly this is what we're doing. We want to make sure you're comfortable with it. So we're communicating very clearly and very transparently from the onset.
That's very good. Other panelists?
Yeah, I think I can echo the thoughts about the medication, because that's something we're dealing with here in Delaware, not just in childcares, but it's something we're dealing with as adults use the same medications to be able to get past screenings at the various businesses and industries, and we're using the same tools, whether it's a childcare or some other business, and we're advocating for random checks throughout the day, so that you do the screenings when someone arrives in the morning. Then periodically through the day, you're checking a classroom, taking a couple attempts, and just kind of moving throughout to let people know that, you're paying additional attention to that, because it is so important to be able to identify those folks that may be symptomatic or may be coming down with something, and so that we can remove them, get them the care they need, as well as protect the others in the environment.
Good.
I too will echo the sentiments of kids dropping off without a temperature, and then throughout the day you notice that something is not wrong, is not right with the child. You take the temperature is elevated. What I do, I have an area room where the child is placed on isolation but not isolated. I contact the parent, and they have a half an hour in which to pick up the child.
Thank you.
And I think the other thing to remember also is that there are people that are asymptomatic that have COVID-19. So all of these prevention strategies that we've talked about with social distancing and all of the creative ideas that you all have had to do these other mitigations are super important, because we're not going to combat COVID-19 just in one way, but with all of these. And I think, having an honest conversation with parents that you're in this together and educating them about the importance of not masking a fever with Tylenol or ibuprofen ahead of time, because your goal is to try to keep it a safe place for everybody.
Yeah, that's an excellent point. So Bo, what's our next question?
Yeah, this one's for Dr. Peacock, and others sure may want to weigh in. A lot of discussion and questions around masks and gloves, but didn't address as much of the social or emotional impacts that come from children seeing adults wearing them or other children wearing them, and maybe speech issues or fear issues. So that's the question.
Yeah, and I think that's a really important question to think about. As a developmental pediatrician, we know that babies and toddlers and children have a lot of social interaction and do benefit from seeing people speak. I think that we're also trying to think about ways to keep people safe from COVID-19. So there's a balance there. I'd still encourage adults to sing and talk to the children, even if they are wearing a mask. That sound still supports that development. And then, of course, engaging with families and saying, there may be a little less interaction if we are all wearing masks or cloth face coverings. So making sure that they also understand how to stimulate a child's development and child's speech at home. I wonder if some of our childcare providers have other ideas as well to keep that stimulation going.
I would share both within our Head Start centers, our day camps, and we're really focused on volleying language, and language is nutrition for kids as they're growing. It's so critical. Personally, during our programming where we've been responding to the COVID crisis, we have not seen tremendous challenges with children responding poorly to adults being in masks. And I think that is because our caregivers, like so many caregivers, are really warm people, and they find creative ways to connect with children. But I really echo that, continuing that language engagement, continuing to, you can see when someone's smiling with their eyes, even if they have a mask on. So you can find ways to connect, but that's not been something that we've particularly seen that children have reacted poorly to it. But I would share that one of the things that we talk a lot about is the emotional impact of COVID, and really the emotional impact of everything that's happening right now. There's so much happening in our country, and just making sure that when children come into a childcare center, it's nurturing and there's a loving environment, and that we're really creating a fun and safe space for them, because kids deserve to be kids and to have great experiences, whether there's a pandemic or not.
Yeah, that is so important.
For me, it's my school-age kids
Yes,
that are in attendance. So they come in their mask, and they're happily wearing their mask because they say my grandparents made it. So they come in their mask. They're not scared. My infants and toddlers are not in attendance, as I said, but the school-age ones, they do come in their mask.
That's great. And sometimes children can be the ones that are messaging and having the adults do the right behaviors. I know during H1N1, we would hear from the children saying that parents, you need to make sure that you're covering your cough or go get that vaccine and that sort of thing. Children sometimes are the voice of reason. So, Bo, what's next on the?
Yeah, thanks. The next one is all about funding and resources and lack of resources available to purchase the necessary equipment or donations. Norma had mentioned some food donations that she had. Maybe she'll want to comment on that, or just ideas and thoughts. And maybe even Governor Levitt, given his experience, may want to talk about this. So, Judy, that's the question.
Okay, wonderful. So, Norma, how about do you want to kick that one off?
So
And then we'll
I
go to
have
the
a
governor.
restaurant that donates food to my daycare during the period of COVID. They just wanted to give back something to the community. They believe this is the way they could help. So they bring the food in, as I said, prepackaged, and I have it delivered to the kids. And they really take this as an opportunity to give back something to the community. And I really appreciate it. So yes, I do get food from a restaurant for the kids.
Thank you. Thank you. And Governor, do you have some thoughts on that question?
Well, I would first just say I hope that our community is both aware and generous in this need. And I would just say I think it'd be valuable for those in settings where that would be appropriate to let foundations and others who are looking for ways to help in unique ways, particularly children, about the needs that you have specifically. The second thing I would say is that the Congress appropriated a lot of money and did not put direct earmarks or did not divide the money specifically in every way. They allocated a lot of it to states and suggested that the states decide. And so what I would recommend is that you call the licensing organization in the state government that you are that you deal with and ask them, will there be specific support for daycare or for childcare provided through this process? And lastly, I would say that there were other monies made available for support of businesses, and that included nonprofit, and it would include as well, as best I understand, even home-based if they're formalized as a business. I think Jamie might have some information about this, but daycare was made an essential workers in most areas for a reason, and if there's a support to be had, they should have access to it. Jamie, do you have insight or any of the others about the availability of that kind of funding?
Yeah, so I can give a couple of examples of things we've done and some of the funding that's coming into Delaware as it is to other states. And that funding is being used to support childcare and other businesses, both as monetary support, whether that be through loans or grants, as well as through the provision of PPE and other needed supplies. And in Delaware, the main agencies that we have our emergency management agency, our public health agency, and our kids department. And Department of Education involved as well. And through the partnerships within the agencies, we are providing support to the child cares. And then we've also established web links on our main Delaware coronavirus page. And basically, if you can provide services, there's a link that you would click there to register. If you are in need of supplies or support, there's a link there that you would register. And if you're able to either donate or are in a position to sell some of the needed supplies to the state, there's a link for that as well. And then we have people from the various agencies in the backgrounds that get daily updates from those lists, work with the communities to connect them to providers, whether it be donation, money, or supplies that they can then purchase.
Very good. Bo, I think we have time for another question or two.
Yeah, I think this will be our last question, Judy. And the question is around multi-symptom inflammatory syndrome, and also some questions just generally around how do you communicate with parents if there is an illness or if there is a concern. So maybe we can address both of those together as our last question.
Okay, and I'm going to kick that to Dr. Peacock to kick off that answer.
All right. So what we know about, it's called multi-system inflammatory syndrome in children, or MIS-C, is that it's a condition where different parts of the body can become inflamed. And these include lots of different parts of the body. So heart, lungs, kidney, brain, skin, eyes, and gastrointestinal organs. And we don't know yet what causes MIS-C, but we know that many children with MIS-C had the virus that causes COVID-19, usually prior, or they had been around someone with COVID-19. We know that MIS-C can be serious and even deadly, but most children who are diagnosed with this condition have gotten better with medical care. It's important to remember those symptoms for COVID-19 that you should be watching for and when to seek emergency care, such as trouble breathing, or pain or pressure in the chest, inability to wake someone up, bluish lips, or severe abdominal pain. But I think the other thing is follow your gut. Parents, childcare providers know their child best. And if the child doesn't look like they're doing well, calling the child's pediatrician or healthcare provider is really important. What's also important to realize is that most children who have COVID-19 don't get very sick. And we are encouraged that there aren't many hospitalizations of young children. We do know that children with special healthcare needs are at higher risk for hospitalization. And we continue to work with professionals actually really throughout the world to understand this multi-system inflammatory syndrome, to find out sort of what it is and how to support children and families.
Thank you. Any last comments from any of the panelists on this question? Go ahead.
I would say that we're treating it the same way we would if a child was ill in the school setting. If we, begin to notice symptoms, we're going to, very much like what Norma shared, we have a isolation area that children can stay in until parents can come. But it's all about that just immediate and direct communication. And then basically we are just treating these conversations the exact same we would in any other circumstance. We've noticed this symptom, we need you to come. It's going to be important for you to take your child to be seen with the doctor. So I don't think there's a need to really kind of over dramatize them. Just direct and to the point.
Yep. Very well. Well, so I believe we're at time, right, Bo? Is that wraps us up. So as we close out today's seminar, I want to thank our Childcare Association partners, including All Our Kin, Childcare Aware of America, the Council for Professional Recognition, and the National Association for Family Childcare for joining with us today, as well as all of our terrific speakers. And I especially want to thank all of our viewers today. Thank you for taking your time to join us. I hope you found today's web seminar to be informative and that it provided a structure to assist you in making decisions that are going to impact you and your business and the children and the parents that you serve. Each of you and the businesses that you represent play such an important role in reopening our economy and protecting all of us. To help us determine how we can improve and build on this work, I hope that you will take our survey that will be emailed to you to let us know if you found this material to be helpful. Thanks for all that you are doing, and wish everyone a great day.